We return now to our conversation with Republican Senator and Dr. Bill Cassidy. Let me ask you about your role on this powerful committee overseeing health policy. You were recently raising concern that the World Cup and some of these other mass gatherings happening in the United States run the risk of transmission at mass scale of some of these diseases right now. Given the cuts to personnel, given the concern you have about what's happening inside these institutions, is American public health up to dealing with this level of risk?
Well, we don't know the complete effort that's being taken. Okay,
You don't.
Well, the Center for Disease Control, for example, has many things going on at any one moment that no one person knows unless you're directly involved in the agency. And so let me just say that. And I have no doubt that there's a commitment to making sure that there is not a widespread dissemination of disease at one of these mass events. I'll say that as well. We do see the consequences, though, of ignoring the benefits that things like vaccines brings for public health. Mm-hmm. And if you will, I think what you're going after is that this administration, parts of it, have tried to downplay the importance of immunization. The Secretary of War, Hegseth, recently did away with the flu mandate, mm-hmm. and then there was a big outbreak of flu in one of their military outfits.
Yes.
If you ignore history doesn't necessarily repeat, but it has a rhythm. And we can look back in World War I, where the Spanish flu went through, decimating armies, but one of the reasons the Germans collapsed is because so many people died from Spanish flu that they had and didn't have manpower to fulfill, that their lines began to collapse. Mm-hmm. Combat readiness means preventing disease. And if you want to be combat ready, you don't want everybody out with the flu.
But he was following the Secretary of Health and Human Services push for medical freedom.
So if you see that, you can see we have a mutual obligation. Mm-hmm. When our founding fathers pledged their life, their fortune, and their sacred honor, there's a sense that we all have to, one, achieve those inalienable rights of life, liberty, and the pursuit of happiness. There has to be also a spirit of sacrifice among everyone else. And so, if we're speaking about how to protect others, yep. Obviously, more people being immunized makes it less likely that someone else gets ill. There's a consequence to not obeying the science of immunization. And one is children dying from measles, as has occurred, and thousands getting sick, with many in the hospital. So I would argue, unfortunately, facts can be a tough teacher. Protect yourself. Talk to your doctor. But society has a vested interest, as we all do, and we all being protected.
We now have a longtime vaccine skeptic who is running HHS, who in private practice sued vaccine makers. How much harm has he done, or do you believe that he has restored trust in public health as you thought he might do?
Well, he has not restored trust in public health, and you can see the administration, if you believe the press accounts, are trying to limit his range of activity. Polling shows that the American people understand that vaccines are important. And for someone to be out there saying that they're not goes against their experience. And again, if you look at the measles outbreak, in which thousands of kids got measles, with the consequences of that, clearly the American people understand immunization is important. Mm-hmm. So I think you can see the administration responding to the American people's awareness that folks should be vaccinated.
But we looked at the vaccination rates, which have plummeted. There is not a single county or parish in Louisiana where kindergarten rates meet herd immunity protection levels for measles, meaning it could still be transmitted. Why do you think that is happening, particularly in red states like yours?
Well,
as Kennedy says, it's not his fault. This predated him, even though he had been working on the issue.
Yeah. So leaving that aside, we can look back two things. One, people have not seen that illness. They've not seen illnesses. So if you've not been exposed to something, sometimes it's a little bit harder to imagine that it can occur to you. If you've never had somebody who's had a child who's deeply mentally retarded because the mama was exposed to a disease while the child was in utero, mm-hmm. You may not be able to relate to it. What we're going to find, though, is that people see these terrible events. When they see children die, a woman abort, perhaps a child unfortunately born mentally retarded, then they will have greater understanding. Facts can be a tough teacher, but they do teach.
Do you see Secretary Kennedy learning from those facts? Is he open to those facts?
He and I have had multiple conversations, text messages going back and forth and emails, and he seems pretty dug in on his positions. And whatever you bring to the table, for some reason, is not adequate. So I don't see him changing his mind.
Mm-hmm. Do you think he's going to still be here after you leave in January?
He serves at the president's pleasure, and so I can't answer that.
You've called forward some of these former CDC officials to share with you what's happening inside public health. Secretary Kennedy went on television and made false claims about the MMR vaccine, even claiming there were fetal parts in it. I mean, you had CDC officials saying the secretary is out there in the middle of a measles epidemic telling people false information. Why isn't that disqualifying for the job?
Well, first, he's already in the job. And so, again, he serves at the president's pleasure.
And you think the president is now aware that this is a problem?
The polling, just what I read in the paper,
yeah.
The White House has seen polling that shows the American people rightly understand that immunization is important. And they see these measles outbreaks, and they understand that that the American people, whoa, we're not getting immunized, and now we have children dying from measles. We have people in the hospital because of measles. We have schools that can't open because of measles. And so the administration clearly has gotten off the anti-vaccine message into something more positive. By the way, let's give the secretary credit. He is very much into ultra-processed foods.
Yeah.
If that's where he stayed, our country would be really much better off. But the concept that immunizations somehow are bad has been clearly disproven by life experience. Because what's happening is people are getting sick, in some cases dying. Mm-hmm. And the administration clearly has moved away from that.
Well, there's no Senate-confirmed Surgeon General, no Senate-confirmed CDC Director. There hasn't been for 9 months now. No Senate-confirmed FDA Chief. 13 of the 27 NIH centers are currently run by acting directors. Is this a problem? Is this something you want to move through by the time you leave?
Clearly, it is a problem, if you will, that would reflect a wider problem at HHS. That just goes without saying. Lack of stability is a problem. But there are people nominated for some of these positions. We will process them in this committee, the committee I'm chair of, the Help Committee. We're in the Help Committee room. As soon as we get their paperwork. That's something we just have to have. There's a process you go through. But I've met with the nominee for the Surgeon General, and I've met with the nominee for CDC Director, and very favorably impressed. And so I imagine they will, I can't speak for everybody, but I imagine they will be approved. And so progress is being made.
Well, I mean, the current CDC Autism and Vaccines page has a heading that says vaccines do not cause autism, very clearly. But there's an asterisk next to it. And it says it's up there due to an agreement with you, the chair of the committee. Do you think there will be strong oversight after January? Do statements like that disappear?
I cannot tell you that it's going to disappear. Excuse me. I can tell you that broken agreement that I had with the secretary, that was not supposed to happen. So once you lose trust in somebody, you're not quite sure what to trust going forward. In fact, you don't trust anything. It should go away because the evidence is that that is not the case. That is a prejudice being brought. And by the way, if you build public health upon a foundation of lies, then you're going to have the absence of adequate public health. You need to build everything in life on truth. I go back to being a doctor. You got to search for the truth and use the truth for your solutions. That sounds kind of, oh my gosh. No, that's the only way you make the correct diagnosis and the correct. This is not truth. And there'll be a consequence of it. And that consequence, unfortunately, will be borne by those who actually are influenced by it. I will say, except for news anchors, very few people read the CDC website. And so I'm not sure how much influence that has. How much negative influence that has.
But the message is heard. I mean, from the President of the United States' own social media account.
Oh, I get that.
He
I totally
links
get that.
the MMR vaccine
I totally get
and
that.
Tylenol to autism.
I totally get that. And that's
Isn't
wrong.
there damage that's done?
Well, I don't, again, people have sensory overload, so I'm not sure how much that does, but that's false. It is wrong. And if you build a position based upon lies, upon falsehoods, that position cannot stand. I am a doctor searching for truth, both for the diagnosis of the problem and how do you cure it. In this case, autism is, oh my gosh, doesn't our heart go out for those parents who have autism? But putting them on a guilt trip because they gave their child a Tylenol or they took Tylenol when they were pregnant is not the answer. You don't make that mom guilty. What you do is you invest those resources into finding the true answer.
You said that Secretary Kennedy broke promises to you.
It's pretty clear.
Do you think he just made those promises to win your vote, that it was just political expediency?
Easy to surmise.
You hate the question of whether you regret your vote, but can you explain why you said yes?
Bobby Kennedy was going to have the ear of the president. The president seems to be fascinated with the Kennedys. So either he was going to be in a position where there were guardrails, and I did have commitments made as to kind of guardrails, or he was going to be appointed White House health czar, in which case he'd have the president's ear without the guardrails. Now, I had to make a decision. He's going to have the president's ear. Is it going to be with some sort of guardrails where there'd be a commitment to meet on a quarterly basis in which there could be regular communication, in which there would be kind of an agreement that I would have, obviously as a chair, I have some role in terms of the people who assist him, or would he be an unappointed, a non-Senate confirmed healthcare czar? That's kind of my choice. And I chose, you can criticize it, but I chose to have the one with the guardrails.
You think you reined him in?
The commitment.
It would have been worse?
I don't, well, that is something that you cannot know. We can't go back in time and say, White House czar. But we do know the president is very influenced by Bobby Kennedy.
But you don't think he should be in that job?
At this point, the commitments that were made to me have been violated. When commitments are made, trust is destroyed. It's difficult to have effectiveness. By the way, I once read, trust is the coin of the realm. If you lose trust, you lose everything here. And by the way, the ability to work with others is essential for a government to function. Essential.
The head of the political action group, Make America Healthy Again, or MAHA, says they poured hundreds of thousands of dollars into your primary race. Do you think it made a discernible difference?
To beat me, I had a governor, a state legislature, a president, cabinet officials, and members of Congress all coming at me. And they obviously succeeded. But we used to have an open primary in which 1.2 million people could vote for or against me, and they closed it to 400,000, trying to distill it down to those who were least likely to vote for me. And among those people, the critical issue is, who did the president endorse? He endorsed somebody different. And so
he openly encouraged a primary challenger.
Absolutely. And and we know why. I voted to uphold the Constitution. The president was offended by that. But that said, it took all that effort in order to beat me. So in one way, I'm complimented. MAHA, they just supported my state's economy. Because the real issue is, who did the president endorse?
The advocacy group MAHA Action touted the win as the MAHA movement's taking its first scalp by defeating you.
Yeah, that's a press release they're going to put out to try and raise money. It was the president's endorsement, period, end of story.
Secretary Kennedy testified last year that he is complying with all the agreements he made with Senator Cassidy. We did reach out to HHS to confirm that the secretary still believes that, but we did not hear back. We have requested an interview with the secretary for this broadcast, and we will continue to do so. Our full conversation with Senator Cassidy can be viewed on our website and our YouTube channel.